I will now begin the assessment of the abdomen. Can you lift up your shirt for me, sir? First, we always start with inspection. I'm going to inspect his abdomen, looking to make sure his color is normal for his ethnicity, looking for any scars, surgical wounds, lesions, any obvious masses. Can you lift your head up for me just a little bit? Now I'm looking to see if he has a hernia present. Let's see. I'm looking for any separation. Next, I'm looking for any pulsation. Oh, you can lay your head back, I'm sorry. I'm looking for any pulsations or movements in the abdomen, like peristalsis from his colon. That could possibly mean that he might have an obstruction, if I could see that. If I could see his aorta moving, that could possibly mean an aneurysm. So I'm looking, I don't see any pulsations or anything abnormal in his stomach. And also checking for ascites. I don't see any. One test we can do for ascites is we can thump, percuss, with the non-dominant hand and the dominant hand tapping on the distal to hear a tympanic sound, because water fluid shifts. So I could tell by the difference in sound, because it would be dull over his stomach if there were no ascites. You wouldn't be able to hear it. Okay, next I'm going to auscultate. I'm going to take my stethoscope, hope it's not too cold. And I'm going to start with the diaphragm, and I'm going to listen just above the umbilicus for the aorta. I'm listening for bruits. I don't hear any. Now I'm going to listen to all four bowel sounds, first starting with the right upper quadrant. And you're supposed to listen for 15 seconds to a minute till you hear something. It should be like pinging and tingling and like gurgling. Now the right lower quadrant. Now the left lower quadrant. And the left upper quadrant. And I hear bubbles and gurgles. Normal is anywhere between 5 and 30. Next, I gotta listen over the spleen and the liver. The liver is on the right, so I'm gonna be listening for splenic and hepatic rubs. That's a yes. So on the right is the liver. Then on the left for the spleen. Sometimes the spleen is hard. It's to find because it's up under the rib cage. Okay. Now I'm going to listen to your aorta again with the diaphragm and the bell. And then down where it splits to the iliac. And down to the renal arteries. And then down to the femoral artery. And I'm listening for bruits. Okay. Or any turbulent sounds. Next I'm going to palpate or percuss. I'm going to strike my middle finger of my non-dominant hand. And I'm going to strike, starting with the right upper quadrant. And I'm listening for a dull sound. Next, I'm going to go mid-clavicular and try and find his liver. And that is usually and you want to percuss. I can't really feel your ribs to count. Around the 11th rib. Right there, where the sound changes. And then I'd mark a border there. Then I'd come further up and I would start and go down. And when the sound changes, I would mark there. So his liver would be around right there, and the liver border should be between 4 and 7 centimeters. And his feels like it is. Sometimes if you can't feel the liver, you can like get your fingers under the rib cage, if you can get them in there. Have the patient take a deep breath. Take a deep breath in for me. And sometimes the liver will come down and touch your fingers. His did not. I didn't feel it. Okay, next, the spleen is harder because of the location. It's under the ribs off to the side, but you can usually start at the 10th intercostal space at the bottom, find the 12th rib and work your way up. And then percuss. Take a deep breath in for me, please. Okay. And I can't feel it, and a lot of times that's normal, because if I could, that would possibly mean it's enlarged. Next, I'm going to palpate, first with light touch. I'm going to start the right upper quadrant, moving a circular motion, moving for mass, just checking. First, well, basically to get his hands used to my touch and get the giggles and stuff out, and kind of warm them up. Then I'm going to use deep palpation, the right upper quadrant, checking the liver for the gallbladder, which is behind the liver. Feel something here. Then going to the left. Okay. And back to the right lower. Over here is colon and the appendix. Then over here is bowel. To check for the liver and gallbladder, I would push down and up. See if I can feel it. Feel the liver border. Okay. Next, I'm going to check the, I'm going to have the patient, I'm going to have you sit up. Sorry about this, sir. Whoa, can you turn this way just a little bit?
This way?
Yeah, this way so they can see. No, the other way so they can see your back. Okay. Okay, now I'm going to look for the costovertebral angle where the ribs meet, and I'm going to check his kidneys. I'm going to test for tenderness. I'm going to take my dominant hand. Do you feel that? Does it hurt?
No.
Should not hurt the kidneys. Should not be tender. And this concludes my assessment of the abdomen.